Morning. My name is Edlon Charlie and I am an emergency medical technician attached to the St. Lucia Fire Service. In order to become an emergency medical technician, I had to partake in a 3-month course which prepared you for your roles and duties as an EMT in the field. So the course runs for 3 months. Upon completing those 3 months, which consists of in-class theory and practical exercises, you are also required to perform 1 month at the St. Lucia Fire Service job training. The 1 month job training with the fire service gives you a brief idea of what it is like to perform in the field. It also allows you to put everything that you learned in class into practice. The role of an EMT is to provide pre-hospital care to patients. Pre-hospital care begins when someone contacts the emergency line to report an emergency. Pre-hospital care includes assessing the vitals of a patient, providing emergency medical care, as well as rapid transport depending on the nature of the call to the nearest or most appropriate medical facility. Working as an emergency medical technician, you are exposed to a person at the absolute worst, which means that you are exposed to blood, feces, urine, vomit. You are exposed to that person when they are at their worst, when they are sick, when they are in pain, when they are in a traumatic situation, be it a motor vehicular accident, be it a chopping. You are also required to respond to childbirths. A day in the life of an emergency medical technician varies because you are in a job in which you are exposed to a number of different scenarios, and every scenario is different. Some days you may only respond to medical emergencies being any form of emergency which comes about as a result of a medical problem. So like someone who has asthma has trouble breathing, somebody who has a heart condition has chest pain. Those are what we call the medical emergencies. You may also respond to trauma emergencies, so a motor vehicular accident, a chopping, a shooting, a form of physical assault. Those are what we call the trauma emergencies. We also get days where we respond to discharges or transfers. Discharges include transporting a patient from their homes to the hospital for a doctor's appointment or to undergo tests, or transporting one patient from one medical facility to another medical facility to undergo tests. So basically, any day is not the same as the day before. You may have one particular type of emergency for the entire day, or a mixture of all the different types of emergencies I previously mentioned. Or you may have a day, which is very rare, that you have no emergencies to respond to. So death in itself is, to me, the most difficult part of the job is responding to patients who are unresponsive or who become unresponsive while in your care. Unresponsive being that the patient shows no vital signs, no heartbeat, no pulse, nothing. The person is not breathing. We are required to provide care for that patient, care in the sense that you have to perform CPR from the location of that emergency all the way to the hospital. Sometimes you are successful in resuscitating the patient, sometimes you are not.
And depending on the patient, depending on the age of the patient, the type of patient it is, it does have its emotional toll on you, and that's something that you yourself will not be able to read about in the textbook. It's something that you could only experience when you experience it, and it does take its toll on you. My advice to anyone who is looking to find their own career path, when you find something you like, research it. Find out what is the most difficult, what are the most hardest aspects of that job. And if you could see yourself going to that job or going into that career and dealing with the most difficult part of that job every single day, and then coming back the next day with a smile on your face because you have that energy, that zeal to want to tackle those problems and want to face those problems, then that is the perfect job or career path for you. If you're going into a career path based on the money, solely on the salary, um, you after a few weeks, days, months, you'll become bored because you'll be faced with the hardships, the difficulties of that job, and after a while, the salary will not even matter to you. So, any career path that you go into, be sure that you are able to deal with the most difficult aspects of it on a daily basis, so that when you get those days where you don't get those difficult tasks, those difficult aspects, you get the easy part. You get to enjoy it, and you get to relish and really embrace and love, continue to love that career that you have chosen.